Cardiogenic shock is when the heart is unable to force enough blood to tissue for it to function. So lack of supply is a pump issue. So again, if we're talking about the hypovolemic shock, we don't have enough volume, so our heart can't pump out the volume that it normally would, therefore not being able to supply the red blood cells. But if someone's having an internal issue, not even internal bleeding, but an MI, myocardial infarction, heart attack, essentially that blood vessel is being blocked and the heart can't pump the volume. It has the volume of blood in the body, but it can't pump the volume enough against that blockage. And so blood's not perfusing to the rest of the body enough. Neurogenic shock, this is when the blood vessels expand and contract due to brain signals and regulate flow. So you see this a lot of times if someone unfortunately like breaks their neck or something like that, diving into whether it's a car accident or a pool accident, and they they break their neck and their nerves aren't signaling the right nerves from the brain to the body to be able to regulate the blood pressure in their arteries and veins for the heart to be able to pump enough volume or whatever the case may be. So they call that a container issue instead of a volume issue. It's a container issue. Anaphylactic shock occurs due to severe allergic reaction, and then septic shock is when someone gets so sick, it's a result of a severe infection, and then it does essentially similar things in the body to not be able to perfuse well. So it's not as common as the other types, but it's still dangerous and should be treated as a medical emergency. So what are some signs and symptoms of shock? Internal body functions are carefully adjusted to achieve optimal results. So our body adapts, and for example, you're having hypovolemic shock because you're bleeding out real bad. Well, your body's gonna start sending signals to shunt blood to your core, to where your organs are. And so it's gonna do what it can to try to overcome and compensate until it just can't compensate anymore. So negative condition to the body adjusts functions accordingly. The body may not be able to maintain that normal operation, and then it gets to the point, it just progresses from left to right. Body gradually exhibits negative effects of the condition, and that's when you start to get your signs and symptoms, and it goes from there. So, what are some of the signs and symptoms? Pale, cool, moist skin, rapid heart rate, which is also called tachycardia, rapid breathing, nausea or vomiting, confusion, altered mental status. Why might someone that's in shock begin to have confusion and altered mental status? Scott, you got any idea?
The blood's not perfusing.
Yeah, essentially their brain's not getting enough oxygen from the blood.
Right.
So you start to get altered patients. Dizziness, dilated pupils, loss of consciousness. That's when it gets real bad. All right, so for us, treatments for shock. The patients exhibiting signs and symptoms of shock, it should be treated immediately and prepared for transport. Paramedic treatment is important, but should not delay transport to a hospital. So, I'll just read this next point. Transport to a hospital is best treatment in most cases and should never be delayed. So, if someone has a road traumatic injury and they're exhibiting signs and symptoms of shock, we want to do what we can to stop bleeding when we can, but oftentimes, we'll have internal bleeding that we can't control. And so, essentially, the best thing for someone with shock is get them to the hospital as fast as possible so that they can do what they need to do at the hospital, whether that's surgery or what. Stuff we can't do in the field. So we want to keep the wounds or injuries elevated when possible. Oxygen should be used if within local protocols. The saying is every red blood cell counts, so even if they've lost a lot of blood, they still have a certain amount of red blood cells. If we can oxygenate those even more than normal ambient air, which is 21% oxygen, if we can give them 100% oxygen, then we're gonna really oxygenate those red blood cells that are left and help perfuse. We also want to cover patient with blanket to maintain body temperature. Obviously, before that, control bleeding immediately.
It's a professional rap joke.
That is.
It's pretty solid.
That's keeping the heat
Mommy
in.
status.
You ain't losing nothing. It's like swallowing a baby.
Yeah.
Swallow.
Guys, I gotta shed a kid, step out. I'll swallow this guy.
That makes me want to try swaddling an adult.
Yeah,
It's gotta be
swallow
an
an adult. Okay.
EMTs and paramedics provide advanced treatments. Are there any questions about shock? I know you guys are pretty comfortable with shock management. Good refresher. Maybe you didn't learn anything new there, but if you got any questions, feel free to shout them out. All right, there we go. Okay, so what we're gonna do is we're gonna get into our 2 skills. So we talked about that last part, and we'll start with oxygen, and then we'll progress to CPR. But the last thing we just talked about was shock management. I mean, we can give oxygen to patients for a variety of reasons, but this would maybe be a situation, let's say this person's in shock and we wanna make every red blood cell count. So, does everybody have their sheet? You might wanna follow along with this. And we're gonna go through what you're gonna be graded on, because this is a skill, so it's gonna be just graded based on each task. So, this first skill is gonna be applying a non-rebreather to a patient. Got that there?
Mhm.
Okay. So first thing we want to do, BSI. So my scene safe. I'm gonna put my gloves on. We can just, for the sake of this class, we can just verbalize that. And then we got our body substance isolation on. We're gonna grab our O2 bottle. Before we even put our regulator on, we're gonna crack the bottle. Why might we do that?
Purging the dust and debris or maybe stuff.
For sure.
Maybe moisture.
What else?
See if there's anything in it.
If there's nothing in it, then we're really putting ourselves behind the 8 ball, right?
Yeah.
So we wanna crack it, and then we're gonna put our regulator on it.
The O-ring.
Yeah, O-rings in it. I tested it before class started, make sure it didn't have leaks. Do you guys feel pretty comfortable with putting a regulator on? Got the 2 little prongs that you're gonna put into the 2 receivers on the O2 bottle. Tighten that bad boy down. And if you get it off kilter, you'll feel it. It'll feel like it doesn't lock in well, and you'll hear it when you turn it on. All right, just to make sure that we're not missing anything. Assemble the regulator to the oxygen tank. We're gonna make sure that the bottle has pressure. We're gonna turn this on. We see we got pressure here. That gauge went up to, let's see, where we at? We're about 1300. We got plenty of oxygen for this. We're gonna check for leaks. You're gonna hear them when you turn this on. It'll leak around here often. We don't have any leaks. We're looking good. We're now gonna attach the non-rebreather mask to the port. Can everybody see okay? Everybody got a good line of sight to this? Okay. We're gonna put it on right here. Make that snug. And then we opened our bottle, right? We checked that it had pressure, but we don't have any, when the oxygen comes into this, once we turn it and tell it where to go, it regulates in here and it gives us the exact liters per minute that we're wanting. So for this application, we're gonna want at least 10. So, let's take a break for a second. Oh, it's all automatic one, you can't hold that one.
Nope.
Alright,
Back from break.
back from the break.
Am I taking his spot?
Yep,
Excellent.
appreciate that.
No worries.
So, we're hooking up our oxygen bottle, set up a non-rebreather to put on patient. We got the bottle on, we see we got pressure, we need to be at least at 10 liters per minute. So we're gonna turn this dial here, go up to 10. And we're gonna pre-fill this. I'll turn it off. I got the call, turn this off. So we're gonna pre-fill our reservoir. Get that bag nice and filled up. Then we're gonna attach our mask to our patient's face. This side right here, the more cone side, it's gonna go over our patient's nose. This thing's all deformed. We're gonna stretch it around our patient's head. And we're gonna tighten it down. We're gonna go right over the ears. It's gonna be most comfortable. We wanna tighten it to where we have a good seal. We're not making the patient uncomfortable. Does that make sense? Does anybody wanna practice that? Feel good to just take the test right away? Okay. That's up to you guys. So we're gonna shut this down. Patient doesn't need oxygen anymore. Bam. Okay, so, Scott, if you wanna start, I'll have you do that, and then I'll grade you here. We'll get that one out of the way. Then we got one person CPR after. Take a written test, we'll be done. Any questions? All right. Got your sheet?
Leave the regulator on.
No, I gotta take that off. Alright,
Alright.
whenever you're ready.
Alright, it's regulated.
Oh. Is this
Oh, yeah, this I see good.
Okay,
Um,
yeah, got your gloves on,
Got the
verbalize,
gloves
you got
on.
your gloves on.
got the gloves on.
Okay,
The patient's unresponsive. Give him some oxygen. Take the regulator. These two lines on the back here. Hook it up to the bottom. You'll know if you don't have it right, cause it'll be out of whack here.
right.
Yeah. Just keep going. We got it. Just read the pressure on it.
Okay.
We're good. No leaks.
No leaks?
No leaks. We're good to go. Take it on a rebreather. Make sure we got this ready to go. Hook it up to the bottle. You see it requires 10. 11.
Probably.
Probably 10, so turn it on to the desired number, 10 is 10. Okay, you actually got bag. Slowly filling up. Got it? Place on the person. They scratch behind their ears. Below the ears, and it's nice and comfortable for them. Make sure that this is another seal, tighten it down. Make sure there's no kinks in the line. Everything's good to go.
Alright. Good job.
Basically, it's not an option anymore, shut it off.
Good.
for?
Show it to you confidentially.
Yeah. I realize that I put it on it.
Get this off. Alright, who wants to go next? Alright. It's your score sheet. Alright, let me know when you're ready.
Alright. Well, be assigned my seat safe.
It is.
Big old gloves on, patient needs oxygen. Gather all my appropriate equipment. Go in, inspect my seals, make sure they're good. Crack the bottle. It's clear and free of debris. Just regulator on. Line my regulator. Tighten it down. Regulator straightened down. Go ahead and open my bottle all the way, make sure I got good pressure to deliver oxygen, which I appear to have at 1300 psi. Go ahead and connect my novel reader and turn it on to a bare minimum 10 liters per minute. Then put the oxygen away. Place the novel reader on the patient. Securing the mask in the face. Study. And delivering oxygen. No kinks, no lines of back. Got good oxygen flow.
Awesome.
Okay.
Yep, that down. Perfect.
Go ahead and shut my bottle off that, that my patient doesn't need oxygen. Put the mask off. Patient, disconnect from the regulator. Close my bottle.
Okay. Good job. Good work. There you go. Thank you.
Yes, sir.
Yeah.
Do I need to, even though I didn't sit through, do I need to do a skill? Okay.
I also could get, Wisemore, because the engine just went on an automatic alarm,
Yeah.
so the maintenance failed.
What's, other than that, it's fine. It's fine. Okay. Miss, I've seen safe, I have my gloves on. I have a patient that requires oxygen, I'll check my equipment. Good?
Beautiful.
Not check for a seal, but I see it in there. 0, check my bottom, 1,000. I can hear it hissing. Assembling my tubing. Set it up to 10. The reservoir will empty, which is the reservoir. Make sure I get a good seal of the patient. Get a slick head. There we go. Looks like it's flowing well, I don't see any kinks in the tube, everything looks like it's flowing like it should. Patient no longer requires oxygen, they're magically healed. Put this down.
to CPR, let's take a little 5-minute break and we'll go from there. So we'll be back in here at 2:34. Does that work?
Yep.
P, I'll be back. Guess your audience didn't care about that.
Make it James.
Okay.
You're good.
All right.
Thank you.
If things fall through, I'll be listening.
Okay.
We get another call, I'll come back in.
Appreciate you.
No problem.
Everybody good? Everybody ready? All right. Last skill. Do you guys have your skill sheets in front of you? Oh, here's yours. Okay. So let's follow along with the skill sheet. And I'll just share yours with you, Scott, just so we make sure we're all on the same page. So we talked about CPR. Now we're gonna do, the skill portion is one person CPR. Now, the caveat with that is the second part, you have a partner that's going to get an AD. So, if you're graded as one person CPR, but we'll get through it. So, following the skill sheet, we're gonna start off with taking our body substance isolation, right? That's actually a critical fail if you don't do that. So make sure you verbalize body substance isolation. And then we're gonna determine, is the scene safe? Is this a scene I should go into? Is there anything dangerous going on? Verbalize that. So we're gonna do as I kind of demonstrated earlier, we're gonna come up to our patient and we're gonna assess his responsiveness. He's laying there just like this. Looks like he's sleeping. Sir, can you hear me? Give him a sternum rub. Can you hear me? There? Doesn't seem that he's breathing. I'm gonna check his pulse for no more than 10 seconds. I'm gonna then direct my assistant. He's pulseless. I'm gonna direct my assistant to grab the AED. So here's our AED. We haven't gone over exactly how to use this yet. But partner's going to get this. That's what it's going to look like. I'll set it up here in a second. He's going to request additional EMS assistance. So even though you're the ambulance, can I get additional EMS assistance? And you check for again, breathing and pulse simultaneously, once you determine that they're not responsive. And then you're gonna say, the patient does not have a pulse. Remember, don't check for more than 10 seconds. If you check for more than 10 seconds, it's a critical fail. Say, okay, the patient's not breathing, you're gonna immediately begin CPR. So, as we talked about earlier, we wanna make sure we're using, or having enough depth on our compressions, which is what? Remember how many inches?
2 inches.
2 inches. Kind of hard to measure 2 inches, but I assure you, you're not going to hurt the patient. So make sure you're going hard. And do you remember how many beats per minute?
100 to 120.
100 to 120. And so if you have to sing a song in your head, I like to sing, staying alive, staying alive. That's the right beats per minute. It's an easy song to remember because you're doing CPR. So we got our hands locked, elbows locked. We're not pushing with our arms, doing good quality CPR using the weight of our body. And what we're gonna do is we're gonna do 2 minutes, which is 5 cycles of 1-man CPR. So you're gonna do 30 compressions, count, make sure you're counting. And this is all while your partner is going and getting this set up. So you're gonna do 30 compressions, you're gonna grab your bag valve mask, get a good seal over the mouth and nose, that C-shaped grip we talked about. You're gonna give 2 breaths. And then you're gonna get right back on compression. For another 30,